What is in vitro fertilization or IVF? It is a complex series of procedures used to help with fertility or prevent genetic problems and assist with conception of a child. IVF, mature eggs are extracted or retrieved from the ovaries and fertilized in a laboratory with sperm. The fertilized egg or embryo or eggs are then transported to a uterus for further development. IVF takes roughly 3 weeks to complete. The process can take longer if these processes are broken down into separate portions.
The technique of in vitro fertilization, or IVF, removes several eggs from the ovary for fertilization in the laboratory. After a few days, 1 or 2 of these fertilized eggs, which are now known as embryos, are returned to the uterus in the hope that they implant and become a pregnancy. Women having IVF are given special reproductive hormones to encourage several eggs to develop in the ovaries. Final maturation of the egg itself is induced by the administration of a further hormone. 36 hours later, fluid containing the eggs is drawn from the ovary with a needle. This is usually performed under light sedation in a short outpatient procedure with the doctor using ultrasound to check proceedings. The eggs collected from the ovary are then mixed with a sample of the male partner's sperm, which has already been washed and concentrated. The eggs and sperm are left in an incubator set at 37 degrees for 24 hours so that fertilization can take place. During this time, only one of the many sperm cells will penetrate the outer layer of the egg and achieve fertilization. Following fertilization, the cells divide and multiply and form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin, flexible tube, where it is left to implant and form a pregnancy. All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world. A consultation and thorough examination are necessary for each individual patient for finding the most appropriate treatment with the highest chance of success. Because female fertility decreases quite quickly after the age of 35, infertile couples should not delay seeking appropriate medical advice.
Examples. 1. Fallopian tube damage or blockage. Fallopian tube damage or blockage makes it difficult for an egg to be fertilized or for an embryo to travel to the uterus. 2. Ovulation disorders. If ovulation is infrequent or absent, fewer eggs are available for fertilization. 3. is previous tubal sterilization or removal. Tubal ligation is a type of sterilization in which the fallopian tubes are cut or blocked to permanently prevent pregnancy. If you wish to conceive after tubal ligation, IVF may be an alternative to tubal ligation and reversal surgery.